Hi, my name is Ramanjit Kaur. I'm a student at Purdue University. I'm a nurse practitioner student, and here I have my patient. We are doing a head to toe physical exam today, and I have asked my patient all the question: name, date of birth, person, place, time. Patient is alert oriented times 4, and the patient knows what she's here for. A patient answered all the question appropriately. uh, Patient is well groomed and the clothes are clean. I don't see any behavior issues, but we'll proceed with the head to toe physical examination. So first, with the head to toe, we can always start with the head. So we can go through the body system. So the head, we will look over the head to see any lumps, anything with the hairline, any skin, scalp issue with the skin, any irregularity that shouldn't be there, any tumor, any if the head is an asymmetrical lumps, sore spots. We can also palpate the scalp. We can ask the patient if there's any soreness, tenderness, if there's anything hurting, headache. I didn't find anything which is normal finding. If there is abnormal, we'll move to further evaluation. And the next we can move to patient eyes. We'll check both eyes, left and right eyes. We can use our light to check a patient parallel pupils are equal, round, reactive to light. We can also see if there is any asymmetrical, anything abnormal, any discharge, conjunctivitis. We can check sclera if there is any yellowish jaundice, swelling, redness, anything abnormal with eyes, any visual changes, blurriness. I don't see anything abnormal, and patient has no complaints about eyes. And then next we'll move to patient ears. We'll check a patient both left and right ears. We can flash a light, see any discharge going on in both ears, anything the patient, anything bothering, any fluid wax build up that it shouldn't be, any redness, discharge, pain, discomfort, color, any swelling in the ear or anything hurting. The patient has no complaints about ears, which is a normal finding. We can also look if there's any masses, any abnormalities in the patient ears. Next, we can move the patient nose. We'll check for septum. We can always use our light to see if there's any discharge, any turbinase, any anything abnormal. Check for the color and the swelling, any abnormalities going on, any masses, any sputum, nasal anything going on with the nasal mucosa or patient and complaining. We also check for face skin, any rashes, bruising, any abnormalities, any pimple, blister, anything abnormal if there is on the face. Next, we can move to patient throat. We can ask the patient to say ah, and we can flash our light to check a patient uvula, tonsil, tongue, all about the mouth areas. If there's any blister, ulcers, anything patient complaining that shouldn't be there, which could be a abnormal finding. And we can also use our tongue depressor to access the posterior of the throat. And we can next move to our trachea. We'll check for midline. We can also palpate for our thyroid glands, anything swollen glands, anything going on abnormal with the neck. We check for neck midline, any issues. Since we are here, we can also assess our carotid pulses one at a time, the left one and the right one. Check for bruit or any thrill. We can listen, we can oscillate the bruit with our stethoscope, with our bell. which shouldn't be there. That's a swooshing sound, which is a abnormal finding. And the patient neck is a midline, which is a normal finding. I don't see anything abnormal, rashes, bruising, anything with the skin going from head to neck. And the patient has no complaints, and lymph nodes are normal. You can I'm going to palpate the lymph nodes. I don't see any abnormalities and swollen glands. Next, we can move to our chest area. So I'm going to look at the chest, if it's how the chest is moving, if it's symmetrical or asymmetrical. The patient chest is moving symmetrical. I will check for the patient respiratory rate, rhythm, which is a normal in this patient. Then first we will inspect the chest, and then we can percuss our chest, both anterior and posterior. We'll see. Then we can osculate the respiratory system, both the interior and posterior lungs, and we can listen to if there is any crackle, wheezing, the sounds that shouldn't be there. Most of the time these are the vesicular sound in the lungs, and also the movement of the chest. Make sure the patient is not using their abdominal muscles to breathe. This is the patient is breathing normal. The respiratory rate for this patient is 18, which is normal finding. And we also check for any dullness. When we percuss, if we feel any dullness, that means we are on the bony area, or hyperresonance. That's when we're tapping the chest. So we listen to the breath sounds, anterior and posterior. And then we'll move to our cardiovascular system. We can assess patient pulses. We can assess brachial pulse, radial pulse, we did a carotid pulses. All are within a normal finding. Then we'll osculate patient aortic, then pulmonic, then we'll move to the Erb's point on the third space, and then we'll move to tricuspid and the mitral valve on the left midline. So after assessing all the points, we have found no abnormalities in the patient cardiovascular system, and we'll document our findings. They are within normal limits, and I don't see any chest when I inspect the skin on the interior and posterior. No skin issues, no bruising, no lumps that can cause any problem. No skin issues like eczema on the arms, and then which is normal finding in this patient. And next we can also listen to our S1, S2 sounds, lumped up sounds, and we can also assess for murmurs. If the patient has any murmur, we can listen to patient heart sounds, and then which is not a normal finding. If we find murmur, we can also refer a patient for further evaluation if there is any bruit, any thrill with our cardiovascular systems, which is a abnormal finding. So that needs further assessment. And we can also look for patient if they have any edema, peripheral edema going on. That means if there could be a sign of heart issues, any fluid retention, or we can also assess patient history if they have any heart failure histories. And any turbulent blood flow, anything abnormal with the heart sounds like murmurs, and then we can always refer patient for cardiologist for if they have a congestive heart failure and any history of a heart failure, or if we see any edema around the ankles or the lower extremities, the patient is retaining. So we have done our respiratory system, cardiovascular system, and the next is patient GI system and the GU, the gastrointestinal and the gastrourinary system. With that, we'll assess the patient. Stand up, someone for a second. We inspect the patient abdomen and see the pulsation, the vibration, and the touch, and then we'll assess the patient all 4 quadrant. And we can always start with either side. We can start with the right upper quadrant. We can move to right lower quadrant. We can go to left upper quadrant. We can go to left lower quadrant. So we will assess all the bowel sounds and see if patient. Also, we ask the patient if they have any diarrhea, any constipation, anything going on with their abdomen. And if they are any tarry stool, any blood in the stool, and then we will palpate and see if there's any pain and tenderness going on, which I don't see in this patient. And then we'll ask about their genital. For this video purpose, we are not allowed to assess, but we can always ask the patient those questions. We'll ask the patient about their urinary status, if there is any pain with or burning urination, urgency, frequency with their urine, any different in color, any smell to the urine, anything that they find out that shouldn't be there, that could be abnormal. And we can also ask the patient, we can, when we assessing abdomen, stand up, we can also assess for patient, we can check for their kidneys, so the one hand the front and the one hand the back. The patient should be in a supine position when we assess a patient kidneys, and when we do auscultation on a patient abdomen. But for video purpose, this patient is standing, but when we assess both the bilateral kidneys for any pain, tenderness, we'll put the one hand behind the patient and one hand at the front. We'll palpate and ask the patient when we palpate, if they are feeling any pain or tenderness. But this patient is not complaining anything. We can also assess for patient renal pulses, aorta, renal pulses, renal arteries, iliac arteries, and then the femoral arteries. And we can check for them also for the thrill and bruit. And for the posterior, we can also check for severe costovertebral tenderness. If the patient, we can tap on it, and the patient, if they are feeling any pain or tenderness, which could be sign of kidney inflammation. So, and we'll also look at the posterior skin, if the patient had any back issues, skin issues going on. So when we're looking at the posterior back, have a seat. We can also ask the patient if they have any kidney stone histories, any UTI histories, any discomfort they are going through. We can also, of course, we're going to do a pelvic exam. We can ask all the question if the patient is complaining, and then that should be further evaluated. And the next, we'll move to the patient musculoskeletal system. We'll check for, in the musculoskeletal, we'll check for patient gait, balance, how they are walking. Is the walk symmetrical? I'll ask the patient to walk so I can see their posture. I need to check patient spine, make sure their spine is symmetrical, and if they are bending or doing something, there is no pain or discomfort. So I'll examine the patient muscles, their bone, their mobility and strength, and if there is any weakness. So turn this side, turn this way, this way. So I'll ask the patient to push my hand to check their upper extremities. Go ahead, raise your arms. I don't see any. Go ahead, have a seat. I don't see any asymmetrical arms moving, and when also they are pressing down, the muscle strength is within a normal. And I can also ask them to push my hand to check their muscle strength, which is normal. The same with the legs, they can push like they're pushing against the gas pedal. I can ask them to push on my hands to check their lower extremities muscle strength. I don't see the both legs are moving at the same time. They are within a normal finding, and also patient has no history of any back pain, any fracture or anything there with their muscular skeletal system. So also we can check for any any variation in size or tone of muscles. If there is any imbalances, that shouldn't be their strength, muscle strength and size. So also there's a if there is a lack of any abnormalities, absence of pain such as edema and warmth when we palpate their joints, and then we'll ask them the range of motion, make sure they are moving in a range of motion, and their muscular strength they are within normal limits. Then and anything there is any weakness with any of the hand or the lower extremities or upper extremities, any dislocation, any fracture, anything that bothering them, any sprain or anything, or with the gait they can't move at the same time, the both feet can't move, so there could be a abnormal finding. And the next we'll move up to patient and neuro. Neuro is a big system. We'll ask the patient, we'll check the patient memory. We can give the patient some words to remember, to check if they have any memory issues, if they have a trouble retaining those words, and we can check always, like we started with the patient, asking patient question if they are alert and oriented. We're checking patient cognitive function, and memory and orientation and awareness, and we'll check patient cranial nerves from 12 cranial nerves to check patient neuro, and which is within a normal limits for these patients. That's a normal finding. We have checked the cranial nerves are intact, which includes the eyes movement. We'll check their jaw movement. We can check for their sensation. We can also use to prick, make sure they are moving at the same, make sure they are feeling their sensation, and the both side they are feeling the same. And if they are not feeling one side the same, if there's weakness or numbness going on, then that could of course an abnormal finding, and then we need to evaluate further. And we can ask for so we can get a cotton ball and ask for the soft touch if they are feeling at the same time both on the same cheeks. We can also prick their lower extremities to see the leg on the legs. When we pricking is the same on the both side. Make sure there is no weakness or numbness going on. We're gonna check a patient. We can also patient to do finger to nose like this. So check their balance, and we can also see their moving heel to shin. So checking their that's also the part of neuro assessment, and their how they moving, their tone and the coordination. And of course we discuss about the light touch and the pinprick with the gauze feeling. And we will also in the neuro will be checking patient deep tendon reflex. So the deep tendon, we can check biceps here. Well, we need to access our tendon, and then we'll need to feel for the contraction. Of course, we'll use our hammer, and then you go with the hammer and see the movement of the contraction. And same on both arms, we'll do DTR. That's the biceps, the brachial radialis, and then we'll go the back side to find out the tendon area, and then hit with hammer and see the contraction. That would be our triceps area. And then we'll move to the patient knees below the patella, find our tendon and check for patient contraction. And then we'll move to the foot, check for Achilles, and then patient for this test, the patient should be sitting, and then when we do check Achilles, the foot is the dorsal flex, and then when we hit with the hammer, it should move to plantar reflex. And again, if there is any abnormalities, DTR mainly they are 2+, we say, which is a normal finding, and if there is any abnormalities with the contraction and flexion of the muscles, and then that requires a further evaluation. And then of course we're gonna ask the patient to do follow-up. We're gonna refer the patient to specialist, and then we'll go from there. And that's consider all of our head to toe examination, which is for this patient within a normal limits. I don't see any abnormal finding in this assessment, and if is there abnormalities, of course, as a healthcare provider, we are required to do further evaluation. And that's all here. Thank you.